The Reverend Eric J. Hall is the president and CEO of Healthcare Chaplaincy Network in New York. And it's one of the premier healthcare chaplaincy organizations in the country. And their mission is to be a multi-faith, nonprofit organization that cares for the human spirit, and they've been doing that for 52 years. By the way, they're one of the largest clinical pastoral education centers in the country as well, training students in pastoral care. They're developing a national center for palliative care, and they are on the cutting edge of innovation. They have been a leader in doing research into spirituality and the difference it makes to people in the healing process and in healthcare settings. From 2002 to 2013, the Reverend Eric Hall was president and founding member of the Alzheimer's Foundation of America, and that makes him uniquely qualified to speak to all of these aging people here today. He took that organization from a startup with a budget of $10,000 a year to a $7 million a year organization with 25 staff and over 1,600 organizations that were members of that organization. And I'm proud to say that all of our Phoebe facilities have won awards in excellence in dementia care from the Alzheimer's Foundation of America. So we've had a connection for a long time. He is an ordained minister. He serves as pastor of the East Chester Presbyterian Church. I don't know how he finds time to do that, along with all of his other responsibilities. He's a certified member of the International Council of Community Churches, and his topic today is the importance of understanding spiritual differences in the caregiving role, and to help us have courageous conversations about that in the places that we work. Welcome, Reverend Hall.
Good morning, everyone. If you could just give me 30 seconds to set this up so I can have some sort of a flow. Great. Awesome. So yes, as you've heard, I am the founder of the Alzheimer's Foundation of America, the second largest Alzheimer's group in the United States. Back in last February, I was stepping out. I had been in leadership and been part of that, and quite frankly, a little tired after it all. So in leaving, it was sort of part of the whole transition for me was the fact that my mother-in-law was diagnosed with terminal cancer. And for my wife's family, this was really the first major illness that they were experiencing. My wife's grandmother is still alive and incredibly robust woman, and makes an incredible cup of coffee too, just so you know. So it was a perfect time to sort of transition out, and my family was getting involved with some healthcare, and the healthcare was going to be focused on Alzheimer's care. So I made this transition over, and then a headhunter came to me and asked me whether or not I was looking for a job, and talked about healthcare chaplaincy, and I said no. Thank you. They came back and asked if I would hold a meeting with some of the folks on the board of Healthcare Chaplaincy. And in the process of getting to know the organization better, it became very clear to me that there was something here that I was really desiring myself. It was a real, very selfish reason for being involved. See, as part of the Alzheimer's Foundation of America and sitting on the National Advisory Board, which we'll talk about a little bit, on Alzheimer's for the country and putting together the national plan, the one thing all throughout the entire experience was that I was never able to really connect my ministerial side to the role and activity of being CEO of the Alzheimer's Foundation of America. So I am probably the first ever moonlighting minister who had a weekend gig, you know, running a church and being pastor of a church. Where here, there was this incredible opportunity. See, all throughout my experience with Alzheimer's and all the people I met in various countries all over the world, you know, it became very clear to me that one of the core principles for every single one of those caregivers was the fact that they really drew from their spiritual experience. Every single one of them were surviving Alzheimer's disease because of their faith experience, their beliefs, their spirituality, and how integrated that was to who they were. And additionally, on top of that, and we'll talk about this a little bit more later on as well, that folks with Alzheimer's disease because some of their very early memories have to do with worship and services and spiritual rituals, many of those folks find comfort in praying the rosary, holding a Bible. There are multiple things that can be done, sitting in front of a crucifix. There are things that can be done that really engages them. So all part of this experience for me, it became very real that in my ministry as CEO of the Alzheimer's Foundation of America, that spirituality was a critical piece. And here at Healthcare Chaplaincy, after 53 years, this is what this organization does. And it's really about trying to drive the message that as much as we have spent time and focused on the physiological, biological illnesses and disease and trying to figure out how to treat and care for people in that regard, in the very same way we have spent an enormous amount of time and energy, and now psychology has come so far ahead, right? We would never think of caring for someone just physically. We always talk about the psychological. But now there is this movement, if you will. There is this groundswell where folks are recognizing that as vital as bodily care and cognitive mental care is, additionally, at the same time, there is an increasing need and vibrancy around and a call for. Most researchers now indicate that, most research done indicates that 70% of Americans think that spirituality has to be part of healthcare. And so in our own culture, in our own society, we see this groundswell of trying to integrate spirituality more completely into healthcare, but in the sense of that integration and in that process, there's a need for an organization like Healthcare Chaplaincy to actually do the research, to start building the argument for what it is that chaplaincy can do, what spirituality can do, what the importance and values behind spiritual care, and then also try to lead and give some guidelines on how to integrate spiritual care into healthcare. Not just to talk about it, but to actually give evidence, to give data that will convince doctors and administrators and the like that spirituality is a pivotal part, and this is much more than the simple thought that you simply call in a clergy person to see a person in the bed. That there has to be a bigger conversation taking place, and Healthcare Chaplaincy is at the lead of that conversation. We have a conference next week coming up where, for the first time in the country, it is a conference on spiritual care. And the research that is being talked about is groundbreaking in the sense that it lends a whole new dynamic and definitions around what exactly is spiritual care, what is the role of chaplaincy, what is the role of clerics in that, and how do we integrate that. And it's really very exciting because Healthcare Chaplaincy has been doing this all these years, has been involved in participating all the time, and it is now that the field of spiritual care is being challenged to actually show positive results, a return on investment, if you will, for why we should have chaplains involved. Why should we be taking the extra steps to provide spiritual care? Now, in this time and place, Healthcare Chaplaincy finds itself in the leadership role there. And so really, it has been an enormous grace. And for me, as Eric, my journey and my career and profession as executive leader has always sort of been and is most valuable to me when I find that it integrates into something that means something to me, and spirituality means something to me. And so I see, for my experience, my faith experience, I see how God has led me to the Alzheimer's Foundation of America, and now here. And hopefully, some of the skill set that I have, together with an incredible staff, and you'll hear from George Hanzo later on this afternoon, we have this incredible opportunity in front of us, and the opportunity to share and talk about it with crowds and folks like yourself and audiences is really very vital and necessary. So let's begin. So you see the background. The National Advisory Council on Alzheimer's disease was really very interesting. I was honored to be one of the 12 selected in the United States to work with the administration, Obama's folks, to put together the first national plan for Alzheimer's disease. Interestingly enough, in that study and in the work that we had done there and in the plan that was released after 2 years of incredible conversations, one of the core principles that came out of that was that Alzheimer's disease is a palliative disease. In other words, when we address Alzheimer's disease, we're looking not just at the physical, we're looking at the social, so social work's involved. So you have the doctor, you have the nurse, you have social worker, and also additionally, in this report, we were able to release that, spiritual care was an integral part for the individual with Alzheimer's, right? Which is, in most of our perspective, we believe that people with Alzheimer's disease aren't able to connect in that way, that they're cognitively impaired and so they're not able to follow through. But there was enough studies done and we had come across enough evidence to tell us that as part of a national plan, if Alzheimer's disease is indeed a palliative disease, then we need to take a look at how are we impacting that population spiritually as well. And then recognizing also that spirituality and that call for care for spiritual care really had to address not just the individual with the disease, but the family as well. And that was really very profound. The question came up about how am I possibly a minister and do all this other stuff. For me, it's grace. Whenever, and it's absolutely true for 12 years, when I was with the Alzheimer's Foundation of America, I did a lot of international travel, and I'm not sure if my congregation sort of structured it this way, but no one really got seriously ill or needed me while I was away. And I was really very happy about that. So God and I have this arrangement. I'm going to go around doing what I need to do. And if you can line up my calendar, it's really very helpful. So it does work. But, the truth of the matter is, like I was saying, in everything that I do, and this is all part of the conversation, really, right? So it's all part of, it's not just about ministers recognizing and valuing the presence of spirituality. It's about all of us coming to an understanding of spirituality in our lives. And if we come to a point where we value that, then there is this opportunity for every single person that we're caring for to integrate those values in and through that experience. So this conversation that you're hearing from me, it's kind of like, well, that's expected. He's a minister. I would say no, because the truth of the matter, I am probably the least pious minister that you'd ever want to meet. I just don't match up to maybe some expectations. But what I do know and what my own experience is that of spirituality. And so it integrates into my responsibilities and my roles. So I want to talk about this part specifically because this is really very important. But before I do, so this is going to be part of your homework before the end today. You're going to be asked to go home and go to our website at Healthcare Chaplaincy, and there is a handbook for patients' spiritual and cultural values for healthcare professionals. You're not going to find this anywhere. Sorry, this is a sneak one, so you might actually have to write this down. So part of the homework will be there's a handbook for patients' spiritual and cultural values for healthcare professionals. And this is on the Healthcare Chaplaincy Network. This is free, it's downloadable. This will become very important after our conversation today as a reference guide so you could keep going back and pick up and get some information around individuals' spiritual and cultural values. And again, this is free and available. If I may, I'd like to quote from this. And George Henza will know what I'm quoting because he was one of the editors. The quote goes, "Healthcare professionals are entrusted to care for patients as whole persons, body, mind, and spirit. The healthcare approach is interdisciplinary and encompassing. It is important then for that approach to be culturally and spiritually sensitive. In addition, healthcare professionals need to be empowered with the capacity, skills, and knowledge to respond to the unique needs of each patient and their loved ones." This is sort of the credo of healthcare chaplaincy. It is a core, fundamental, dignified statement by us in that we understand that what we're talking about today about spiritual differences and cultural values is really an integral part of care. We cannot be providing whole person care if we're not looking at and integrating these two aspects. But I want to start by explaining that there is a difference between spirituality and religion. So religion refers to any organized belief system. And I'm sure if we were to spend some time just going around the room, you know, the major religions are sort of all known to us. Christianity, Judaism, Buddhism, Islam, Hinduism. But also, you know, these organized belief systems have practices and forms of worship that generally are toward a higher power, and that they're complete with rituals, symbols, and prayers. Harold Kushner, one of the prolific writers, Jewish rabbi, writes and comments that religion is primarily a set of beliefs, a collection of prayers and rituals. Religion is first and foremost a way of seeing. It translates the world as we encounter it. Religion is first and foremost a way of seeing, and it translates the world as we encounter it. It's important to recognize that in most of the major religions, you will find that there are multiple faith systems. So under Christianity, there is Catholic, Lutheran, Protestant, etc. The same with Judaism as well. And so it is important to recognize that when we're talking about religions, that every single one of those silos, if you will, of religious belief, you know, has unto itself unique and distinct spiritual principles that it finds and values above all others. And that even under Christianity, with the wide array of families, you will find distinctiveness. And the importance of that is not to believe that we as healthcare professionals can encounter anyone at any time and simply believe because they're Christian that their principal values are the same as ours. And that is instinctively important to integrate into our care of individuals. Spirituality, however, which is what I'd like us to talk about today, is a little bit different. It is the motor by which religions operate, but generally spirituality itself really lacks clear definition. It really is more, spirituality really speaks more to the search, the human spirit search for the higher power, for the sacred, for the real self. So it is intrinsically different than religion is, and that is what we're talking about today. It is perceived, spirituality is perceived as being actually more fluid with no limitations. And even though it is active inside religions, that a person's spirituality may not adhere to all of the tenets of the religion. So we have to recognize that for ourselves, when we are Catholic or Presbyterian, there are a list of principles that are set as being central to this belief system, but it's possible that an individual, including ourselves, may not adhere to every single tenet. And so when we're approaching folks who are ill and when we're caring for other people, it's important not to lump them in and simply believe because they are Catholic or because they're Jewish in these broad statements that means that they adhere to every single principle, because there are principles that really can make a difference for that individual and will either lead to their healing or to their lack of healing. And we'll talk a little bit more about that as we move along. Spirituality really speaks to a relationship in that searching. That person's search really has part of it this relationship either with the higher power, with oneself, and that it is really, spirituality really speaks to life is living in an awareness. To an awareness of life and meaning that comes from our experiences. It really, spirituality is seeking meaning and comfort. Spirituality is the seeking of meaning and comfort from life's experiences. And that is very different in some ways, in many ways, from religion. So if you go up to someone and you ask them, what religion are you? And they come back with no answer and they say, I'm not. That doesn't mean that they're not spiritual. And that is a critical, important difference. And the reason why we might make the judgment that they're not spiritual is because we have already established a set of guidelines on how we judge and assess ourselves, others in our own worship space, other religions outside that worship space. But it does not mean that a person who does not practice a religion does not have any spirituality. And part of what we'll go over today is part of the communication process by which you can help sort of glean from them what are their spiritual values that are important to them, and how can I, as a healthcare professional, address those needs and care for them as effectively as possible? How do I provide for them even when there is no structured religious tradition that they belong to? But again, spirituality sort of goes beyond even religion in a lot of ways. Here's some points around spirituality that I think are important to pay attention to. One thing that spirituality tries to do is it searches for meaning. What do we make? What is the meaning that we find from our own existence? One of the taglines for the healthcare chaplaincy since I've come on board is caring for the human spirit. And the reason that I use that, and the reason I proposed that to the staff for a tagline for us, is because I believe that every person's experience, the existential questions of what we ask about what is the meaning of my life, what is the purpose, where am I going, what is this all about? All of those questions are entirely spiritual in nature. And so as healthcare professionals and as an organization, Healthcare Chaplaincy, it was all about how to care for that human spirit. The second is community. Spirituality can lead to community. Religions are one example of how spirituality becomes an organized set of belief and thereby pulls together a community. But recognize that for folks who may not adhere to a religious tradition, that there is still community. They will associate with others and have conversations, and there may be very significant people in their life, perhaps not professional clergy, but there may be very significant people in their life that really make all the difference to them and understand and connect with them and have helped them find meaning in and through their journey of life. And those people, identifying those people, may be very important and valuable in providing spiritual care for the individual before you. Hope. So I actually looked up a definition, and this is what it says. Hope is the feeling that what is wanted can be had, or that events will turn out for the best, or the act of looking forward to something with desire and reasonable confidence, or feeling that something desired may happen. One of the tenets of spirituality is the innate human experience of hope. And identifying what the person before you is hoping for is part of the spiritual conversation and how we identify how we could be most effective and helpful for that individual. I came across this quote from Alfred Adler who said, "We cannot think, feel, will, or act without the perception of a goal." And so everyone, even if they are ill and sick, is acting under this precedent of hope, this principle of hope. Understanding what that is and how to communicate that and how to fulfill that for that individual is really quite important. And then finally, what is holy and how do we relate to that? What is sacred? What is the awesome for the person that you are caring for? What is that which we find awesome? And again, I would simply indicate, that this can be in direct contradiction to religious beliefs, that sometimes religion may or may not structure completely a person's spirituality, and those nuances can be very vital and necessary. But here's why this is so incredibly important of a topic, and why I'm so glad that Phoebe Institute wanted to address this, is because there has been substantial data already done and gathered from research that indicates that spirituality plays a role in healing. Spirituality plays a fundamental role in healing. It can provide healing. And now more than ever, it is recognized as being able to do such. Did you know that prayer is one of the most commonly used pain relief medicines? So the Journal of Pain and Symptom Management in 1998 reported that American Pain Society questionnaire that after pain pills, 76% of the individuals who were surveyed reported that prayer was a vital part to their pain relief regimen. But there is a distinction here, and I want to play this out because it sort of follows in the conversation. Well, are you talking about spirituality can cure? And I want to talk about the differences between curing and healing. See, curing is a biological remedy. Curing means you have a disease and then you no longer have the disease and you are cured. Healing may or may not involve curing. And this is important for us to understand as providers in what it is that we're trying to provide. We're not necessarily only trying to provide curing. We're doing that by the medical intervention that we're providing. But additionally, here in this regard, this is really more about healing. Healing involves extracting meaning and finding peace and comfort with one's circumstances. Healing involves extracting meaning and finding peace and comfort with one's circumstances. Comfort is a sense of physical or psychological ease, often characterized as a lack of hardship. And tell me, when you're encountering someone who is significantly ill, besides cure, aren't we looking to provide this type of healing? Aren't we looking to provide this type of relief? And spirituality has within it the ability to provide peace and comfort, as well as meaning. And I think we're all sort of very, we are aware of this, but maybe not right in the front part of our minds. But it's really not uncommon to be told that people receive comfort from their beliefs and their spirituality when they're grieving, right? Don't we find that when we experience a loss of someone, that we fall back on that which we believe, and that where we find meaning, where we find comfort, where we find peace. So we find this all the time, and we experience this in bereavement, right? Don't we also have the experience of people who have been distanced from, structured, institutionalized religions to find their way back because they find something inherent in that, and they actually, what it does is that ritual drives the longing that they find inside, what their spirit is really searching for. And so in the very same ways as we find this in the bereavement process, and this could be a vital part of the bereavement process, it's also a vital part in the life of our patients. Spirituality is very common in discussing end of life. It's part of hospice, right? It's understood that this is something that we would do, that we would provide this. It's unthinkable in how we understand our healthcare system today that people who are dying would be void of any spiritual care. That's why it's part of the hospice model, and that's why all hospices, must provide spiritual care as well. It's part of palliative care, as I mentioned earlier, that spirituality and spiritual care is a tenet of palliative care. I would argue, from my experience, especially with Alzheimer's, which is not necessarily a terminal illness, that spirituality is important, valued, necessary, and should be integrated in the entire healthcare system. That we simply cannot hold it to something at the very end and say, oh, well, we should address this now. We should provide this person with the opportunity to talk about what this is. Because if the studies are right and actual and factual, that people really utilize and work with and incorporate their spirituality through their significant illnesses and their illnesses in general, then why isn't that more important to us to integrate that from every experience with every person, no matter what they're doing? How many times have I been called to a bedside for someone who is going in for an operation? I mean, I remember once with tonsillitis. You know, the family asked if I would come in and say a blessing. There's nothing terminal about that experience, and yet that family found comfort and peace and meaning in having a minister bedside to be providing that. And I'm sure if we went around the room with the other pastors and ministers and alike in the room, that we would find similar experiences, right? It's simply because people draw at their time of challenge, when they're feeling sad, when they're feeling anxious, when they're feeling fearful, this is where they draw their strength from. And that is incorporated, I think, throughout healthcare. I was in the hospital last week. I had a lower intestinal infection. Don't ask, I don't know. And I didn't put it there. The only thing I knew is my wife couldn't yell at me because it was nothing I did. So I felt really good about that, you know? Because usually anyway. So the fact of the matter is, in all of that, listen, when you are sick and you are doubled over in pain, trust me, God and I were on first name basis. You know? And so, that's an extreme. But I would say to you that almost everyone who ends up entering a doctor's office because they're not feeling ill, or going for testing, or having to stay overnight in a hospital, everyone is asking themselves those existential, hence spiritual questions about what is happening to me, what is this going to mean? And if spirituality has the ability, and it has been shown to be so, should not we be using that skill set, that experience that people have, to actually help them through the process of their experience and their healing? I think yes. And more, I'm hoping that we will find this as part of the conversation in healthcare. So the question really comes down to the courageous conversation. And I say this because I do think it's courageous. One of my visits with one of our chaplains to a bedside, was an individual who was very ill, and I went with the chaplain just to sort of see what they do. And engaging in that conversation is really very difficult. And it's really hard to know where to start and how to go through it and what to say. But the fact of the matter is that if you can find a time, right? And that's one of the problems here, is that as professionals, we are so incredibly busy, especially if we're healthcare professionals. We are so incredibly busy moving from one person to another, to another, to another, that from the moment we enter to the time that we leave our job site, we're generally on all the time. And now you're saying that I need to do something else, Eric. Now you're saying that I have a responsibility to actually be providing for their spiritual care. Well, I'll make a referral to the chaplain, and that's great. If people would do that, that is great. I have to be honest and tell you that that's not always the case. And so if that's what we come away with this, that's wonderful. But I would say that there is an opportunity before all of us to do good or not. And some of that might involve simply us engaging. And so making the time, getting through our excessive workloads, and breaking the barrier, asking the questions. Taking the time and actually asking the question is probably the greatest discipline that we need to come up with as professionals, to recognize now that I have a level of responsibility for the spiritual care for this person. It's important to recognize that a person's spirituality differs greatly from ourselves. And so now that we've talked about spirituality, it's really important to recognize that not everyone believes or feels or thinks or perceives or finds meaning and comfort and peace in the very same way that I do. And that type of a distinction is really important when approaching anyone. To have a basic understanding of a patient's spiritual needs and preferences so that they can receive respectful care is vital. And then respecting any wishes that the patient expresses, even if it is in contradiction to our own belief systems, is vital and important. For instance, Jehovah's Witnesses may refuse a blood transfusion because it's not part of their spiritual structure of beliefs. It's what they are. It's what they believe. It might be very difficult for some of us to encounter that, and this is an extreme example, but it is very important that we honor and respect the patient who is before us and accept them for where they are, as they are, and assist them in that capacity. This talk about spiritual care has very little to do with us. It has more to do with understanding what the patient needs and providing for them as much as possible. Doing everything we can. Phone calls, referrals, presence, all of that is really vital and necessary. It's also important to note here that spiritual differences are not simply between us and our patient and the person that we're caring for, but also additionally that there may be differences between what the person we're caring for believes and holds and values as meaningful and purposeful in their life and that of their family. It is important to recognize that every individual must be accepted as they are for what they are, and the family has the right and to provide spiritual care for them is equally important, but we must recognize that the family's traditions and beliefs are not necessarily the same as the person that we're providing care for. The person before you is of most vital importance at any given conversation, at any point of the conversation here. And so sometimes it is up to us to sort of delineate the differences and understand and define the differences and maybe to explain them to the family members as well. Because sometimes family members will come at this in a very specific way. I have a member of our community, and his father-in-law was passing, and he asked if I would come to the house. And I said, fine, is he Presbyterian? And he said, no, he's Roman Catholic. And I said, Tom, I would love to come. And I will come. And I did. But ultimately, it's up to him to determine if he wants to see a Roman Catholic priest or not, whether he wants to receive last rites. And so, yes, I could come and be a support, and the presence, and we'll talk about that a little bit later, presence is really important. Just being there sometimes makes all the difference. But as far as rituals and beliefs and where that person finds meaning, it's not in a Presbyterian tradition. It was in a Roman Catholic tradition. And so ultimately the person did receive last rites, and the wake service and the funeral was done in a Roman Catholic church, which is proper to that person's experience of the spiritual values in their life. And we have to be okay with that. We have to be okay with that. Which sort of leads to this conversation about how important it is for caregivers to have general knowledge of various spiritual traditions in order to care for the diversity in our patients. Now, the issue here, and we all know this now, right? You and I live in a society where it is multicultural, to say the least, right? Just driving around Allentown last night trying to figure out a place to eat. There is a wide array, which, by the way, no one gave me a recommendation for. Pizza Hut was fine, thank you. And I actually wanted Pizza Hut, to be honest. But as you drive around, you see the experiences, of all the different foods, just in Allentown. You go to Manhattan, you'll find everything from every place all across the world present there. And so we live in a very multicultural society. And we have to recognize that this now is an integration of cultures. When my family grew up in Jersey City, my mom was Greek Orthodox, my dad was Roman Catholic Irish, don't ask. There was one neighborhood for the Greek Orthodox, and then there was another neighborhood for the Irish, and they saw each other literally and met each other by eye contact from corner to corner. And then when they wanted to walk together, they would go over to the Italians and sort of hang out over there. But that's not really much of the case anymore, right? It's much more becoming an integration of cultures. And with that, you know, there are going to be some challenges in being caregivers. And some of this we will pick up and learn along the way from our experiences. Some of it, honestly, and it goes back to, you know, this handbook, you know, there are resources available that if you encounter someone and you don't know what those traditions are, resources such as this could be really very helpful. So it's important to recognize that there are challenges in becoming familiar. Let's be honest about the challenges, that this is something that we really need to sort of spend some time with, and it's a requirement for us to learn a little bit. It's also difficult, as for some, the only exposure we will have to any of these cultures or spiritual traditions is going to be from our healthcare space. We simply might not hang around with anyone who's a Muslim. And so we won't know that until we come across that in our active professional care. Caregivers are, you know, again, could be dependent on the written sources of information, but I also want to go back to the point where it is ultimately checking the practice out with the patient. Asking the person you're caring for what they hold to be valuable and necessary. Providing for those needs, holding that conversation. And again, not lumping everyone simply into this says it, so that's the way it is for everybody. It doesn't necessarily work that way. And the more that we could understand what is most valuable to the person we're providing care for, that is where we make the most significant difference in their life. And so it's worth the effort because of what it brings to the person we're caring for. It's also important to recognize that, you know, some of our exposure really comes from the media. And we have to understand our assessment, and whether or not we want to hold this to be true, our assessment of religious traditions, spirituality, the like, all comes from how we have learned about it and how we perceive it. And the more sensitive we can be to that reality, the more helpful we could be to another individual. That we really need to find a place where we can sort of back ourselves out. It's critical to have an awareness of our own spiritual traditions and worldviews so that we could become aware of our own biases and limitations. Listen, folks, we all have a thing called the ego. We all have faith traditions that we adhere to and we hold as valued above all others. That's why we hold them. And it is a real discipline for us in encountering another person, especially if they are ill and sick, to let go of all of our own baggage, our ego, so that we can be impactful and helpful to another person. Limit the assumptions we make about our patients and their values. If they're patients, if they're people we're caring for, honestly, in the very same way we provide medical care, it's all about them. It's not about us. It's really all about them. It's not about us. And the more that we could be focused on that principle, I think the more valuable it really is. I'll go back to what I said earlier. In every single encounter, you are in a position to do so much good or not. And sometimes our own values and our own assumptions may limit our desire to engage with a patient because of how we're perceiving that. The more sensitive we are to that, the more we could get ourselves out of the way, which is really the role of chaplaincy, right? For those who are chaplains. It's all about getting out of our own way so that we can be totally present for the other person. But if spirituality is as valuable as it is, and if there's data to substantiate that, then not to do that, are you not causing some level of harm to the individual? Don't we have a responsibility to discipline ourselves in this regard, to take up spiritual care, but then to do it as best as we can? And ultimately, listen, if nothing else, we make the referral, we make a phone call. We connect the person to someone who can be most effective and helpful for them. And if that's all we did, that would be an enormous benefit to the individual. So it's just primarily that patients draw out, from their own spiritual resources. Our job is to help them tap into what they find meaningful. It's our job to help them experience community. It's our job to find out how they encounter hope and how we could support that experience. It's our job to find out what they find holy and what they find sacred. And I believe this conversation is probably most appropriate here today, in this building that houses sacred space. Because all that is holy here is present in every single person that we're encountering. How do we help them find that, hold on to that, and find comfort, meaning, and peace through that experience? So there's a question of, sharing the patient's faith. And this is where we sort of try to get out of our own way and be there for the patient. We ask questions. We take a back seat to the conversation. Don't lead. This is not a time to proselytize. And I'm hoping one time said is enough. We could be very energized and enthusiastic about our faith belief and our experience of God, and that is proper. And there may be a time in your experience that you can share that reality with the individual, but ultimately, for the most part, we have to take a back seat to the conversation, allow the person we're caring for to lead us, allow them to talk, ask questions. What denomination are you? What spiritual activities do you perform? Ultimately, to determine what they are, to respect those beliefs, and to provide, for a chaplain, again, or a clergy of their faith. So one of the ways that this can be done, this type of conversation, are from spiritual history and assessments. And I know that George Hansa is going to talk about some of this a little bit this afternoon, so I won't go into it. But there is a spiritual assessment tool called FICA. It's F stands for faith or beliefs. This, by the way, is inside your folders. Faith or beliefs. I stands for importance and influence. C stands for community, and A, stands for address. And there's a lot more information here about how some of that conversation could go and how that can be helpful. I want to point out something which may be obvious, but I want us to recognize that even if you go to talk to someone about their spirituality and you're taking that step and you're going out of your way and you want to help and you want to provide spiritual care, please recognize the answer might be no. And that's okay. And it may not be no forever, but at the moment, that's where they are. So I have some time. I wanted to talk with you a little bit about my own family experiences. So my mother, 4 years ago, was demented. She had probably early onset of some sort, and additionally, she had terminal cancer, lymphoma. And so she came, and you always know when your wife really loves you when she says that you can bring your mom to the house and provide for care, right? Because you don't know how that is, and it's terribly challenging, and we had a 2-year-old at the time, and so trying to work all that out. But bringing my mom in, now I shared with you, my mom's Greek Orthodox, and so my mom had, this experience of not always knowing why she was at the house and that she was dying, and that's a conversation I probably had without doubt, probably around 60 times with her, explaining to her whenever she really became clear about what exactly was going on. And in those times of her clarity, I would ask her whether or not, did she want to see a Greek Orthodox priest? Can I? And in the beginning, for the longest time, she would say no. She wasn't practicing, and she simply said no. And yet, in the midst of the conversations, and so for my mom and also for my mother-in-law, my office turned into the site where care was being provided, because there's a bathroom on the same floor, all those reasons. And so I would be working at my desk, and my mother and then my mother-in-law will both be laying in the bed. The encounter of the conversation back and forth, and maybe some of it is a little bit easier, or maybe it's second nature as a minister, in the sense of asking what are you thinking about, what worries you, what concerns you, asking about regrets, asking if she's afraid, right, in her moments of clarity, is she anxious, right, all those things. And some of that, you have to ask those questions anyway, because you have to give medicine, but also to understand what's causing those moments of anxiety and fear for her, were really very important and fundamental. It's important to recognize that my mother went from a period of her time, and it's only because I kept asking questions and communicating, that she didn't want anything, no icons in the room, no Greek Orthodox priests, nothing, to a point where she asked. We have an icon from Greece that is handmade of the Trinity, and she asked for that to be brought into the room, and then she asked if we would light incense, which is very common and ritualistic for the Greek Orthodox. And then at the end it was, bringing in a Greek Orthodox priest. But recognize, if you will, there's changes here. And so as they're progressing and as they're experienced, please recognize that asking once doesn't always get you there. And that sometimes it's okay in real nice ways to sort of ask again. And so the icon, was something she asked about. The incense, because I knew as a child in our house growing up, that was very common and part of the tradition, and lighting a candle, the other thing was a candle, and then ultimately the Greek Orthodox priest, and then having the conversation around, what her funeral was supposed to be like. And that conversation, changed, how she wanted to do it. First, I think she didn't want to offend me, so she wanted me to do the burial, the funeral. And I said to her, it's fine. I'm okay. I don't need to do anything. What would you like? What's important to you? What brings you meaning and purpose? And so in the end, it was in a Greek Orthodox church. My mother-in-law was very different. She was diagnosed with gallbladder cancer, and terminal. 6 weeks to 2 months to live. It was very aggressive, came out of nowhere. She was fine on Christmas. January, she ends up with stomach pains. The next thing you know, we're dealing with gallbladder cancer. They try the chemotherapy and all that. None of that's effective. She too requests to come to our house. I guess she saw we did a good job the first time, maybe. I don't know. I told my wife we should just get a hospice license and open up my office, for services. But she came to us, and in both of those experiences, by the way, I would not trade any of that for the world, because of what it was and what it did and what I learned, through the experience. And so we should never be afraid of illness or death or dying and the impact that has on us. And the more open we are to that, I think it allows us, some growth, and probably, in my case, much needed growth in a number of different areas. So for my mother-in-law, she's Honduran, and so Roman Catholic. And so, for her, it was vitally important that she had with her at all times her Bible. And it's a small little Bible, and it's simply just what she had. It was in Spanish. And sometimes late at night, we had a monitor in the room. You'd see her get up, and try to read something or try to flip through pages. Later on, it became very important because of her devotion to Mary, the mother of Jesus, that she would have a rosary in her hand. And so she would hold that. When I asked her whether or not she wanted a Roman Catholic priest to come for last rites, she said no. And when we asked constantly, she said no, and in the end, she simply asked me to do it. And so But that's where she was, and that's what I'm saying. You can't just box people in and say this is all they're going to get. There might be other people in her life, that meant something, and I was honored that I'd be that person, as difficult, as all that was. But then she did want the Roman Catholic funeral, and she asked if I would do the graveside. But this conversation is about two experiences that end up with people passing, but please recognize that these conversations apply throughout all of healthcare and any experience, and so are important to have, for all the values and reasons that we had just talked about. But here, clearly for my mother, in a gradual sense, and also from my mother-in-law, they drew, out of their own experiences. How can we identify spiritual struggle and respond appropriately? And then ultimately the conversation about spiritual struggle. It's just important to recognize that, in your patients and the person that you're providing care for, your loved ones, professionally, whatever the case might be, that they might be experiencing spiritual pain. That there is a pain that can come from having conflict in one's spirituality, or feeling regret in one's spirituality, or any number of other reasons. And so some of the reasons why people will tell you no is because it's too painful to go there. And that's why if you keep bringing up and keep inviting them to explore, it allows them the opportunity to transition and to integrate some of that, which brings them the peace and the comfort and the meaning that they need and want and desire. But sometimes not everyone understands that you have to go sort of through the pain first to get there. And so in spiritual struggle, sometimes it is the challenge that the person might have to address that. And it might be easy to come by as far as being recognizable. It might not be. Sometimes you could pick it up in a person's conversation. Again, simply recognizing it, if nothing else, to make a referral. And the last piece that I want to talk about, because I know I'm out of time, I just want to talk about how important it is to be present. We talk about spirituality, we talk about noticing the differences. This is work, some of this is academic, right? Some of this is additional time, additional attention. Some of that really, can weigh on us because of all the responsibilities we have, whether we're a family caregiver or a professional, whatever the case might be. But, the one thing with folks with Alzheimer's that taught me the most about the human spirit was the ability simply to be present and to hold their hand, and the difference that made for the person. And sometimes in our conversations about spirituality, though we went through all this today, sometimes it simply comes down to being present. And if nothing else, to sit there and to hold one's hand is an incredibly powerful activity. And we don't often think about it because we always think we have to have an answer. We always think that there's something more we have to do. There's always, we're busy. We're busy in our heads. And for the most part, with my mother and my mother-in-law, my being in the office, working at my desk, and them laying there and having the conversation and being present really meant all the difference. So in the midst of all this, I'd like us to come back to what is the fundamental reason why we're holding this conversation is to provide the most of care that we can, and thereby including the spiritual as necessary, vital, and important, and valued. But I would also say your human presence, holding a hand and smiling. If you go up to a person who's with Alzheimer's, even in late stages, and if you sit and hold their hand and smile, they'll smile. It'll change their mood. It'll change how they feel. And I think that is because when you take away cognition, you end up with the human spirit. And the human spirit, by nature, connects to others. And that is really a vital, necessary part that if we take away nothing else today, it's to take a moment and to hold someone's hand. Thank you so much for having me. God bless you all.